Mbugua. After we are done with that, then we will proceed to question number 063. Now, Honorable CS, this is the procedure we adopt during this session. The Honorable Senator who raised this question will first rise to ask this question. I'll call upon you to respond to it. Thereafter, the said Senator will have an opportunity to ask you 2 supplementary questions arising from the primary question. He may elect to ask those 2 questions at a go, or he may elect to allow the other colleagues, if any, who wishes to ask any supplementary questions to pose those questions, and then thereafter he may come last in asking a supplementary question. So that is the procedure we are going to adopt. How we then respond to these questions is extremely brief, concise, so that you don't have to give a whole speech, Honorable CS. Straight to the point, concise, and very brief. I will therefore be requesting the Senator George Mbugua, MP, to proceed to ask question number 019.
Thank you, Mr. Speaker, sir. I rise to ask question 19. I would want the CS to tell the House what measures the government has taken to ensure that reproductive health services are accessible to persons with disabilities in compliance with Article 43A of the Constitution, and B, could the Cabinet Secretary provide a list of all the medical facilities equipped with disability-friendly infrastructure and indicate the training programs developed and resources deployed by the government to medical practitioners to ensure they are adequately prepared to attend to persons with disabilities, and C, to tell the House what measures the government is doing to ensure that such services as occupational therapy, speech therapy, and behavioral therapy, which are essential for children with disabilities, are covered by the National Health Insurance Fund. Thank you, Mr. Speaker.
Honorable CS, you may now proceed to respond to that question.
Honorable Speaker and honorable members, I would like to take this opportunity to thank the Senate for inviting me to appear in this plenary and respond to the questions. Honorable Speaker, I would like to begin by first thanking the Senate for their indulgence. I am supposed to have appeared here 2 weeks ago, but I requested to be given time to prepare for the launch of universal health coverage, which we did during Mashujaa Day, and I want to thank the Senate for that understanding. The second, Honorable Speaker and honorable members, I would like to thank this esteemed House for the support, immense support, that you gave to the ministry in ensuring and enacting the 4 bills of universal health coverage that are going to change how we deliver healthcare in this country, and that for the first time as a country, we are going to be focusing and ensuring that the citizens of this country live healthy, vis-a-vis the previous, where we were waiting to repair broken health systems. So I really want to thank the House and the members for that support. Having said that, Honorable Speaker and honorable members, referring to the question regarding disabilities and how they are able to access health services, I would like to respond as follows. Persons with disabilities form a significant part of the world's population, yet as one of the largest groups, their rights are often the least advocated for. The Ministry, in collaboration with relevant stakeholders, is working tirelessly to advocate for persons with disabilities by developing and streamlining disability-inclusive policies and enhancing the ease of accessibility to facilities and services in the health sector. Honorable Speaker and honorable members, the ministry developed the Kenya Health Sector Strategic Plan 2018-2023 that prioritizes health system strengthening to realize universal health coverage, and has further developed the rehabilitative services and assistive technology strategy of 2022 and 2026 to guide targeted investments to promote access for persons with disabilities. Disability mainstreaming mechanisms within the health systems are ongoing in health facilities to enhance the unhindered safe movements of people with a disability and access to reproductive health services. The ministry has emphasized on all health facilities, including level 4, level 5, and level 6 hospitals, to ensure the integration of disability-friendly mechanisms to enable the inclusivity of all Kenyans. In the recently concluded facility assessment preliminary report, the ministry evaluated whether the health facilities had disability-friendly infrastructures, that is ramps, lifts, disability-friendly washrooms, disability-friendly maternity beds, and wheelchairs, amongst other items. Out of the 12,483 facilities included in the analysis, 47% had at least one disability-friendly infrastructure. 82% had at least a ramp, 54% had wheelchairs, 15% had disability-friendly washrooms, and only 7% had disability-friendly maternity beds. Further analysis revealed that 80% and 42% of level 6 and level 5 facilities had disability-friendly maternity beds, while only 22% and 8% of level 4 and level 3 facilities had disability-friendly maternity beds. Reproductive health and maternal health services are offered in both outpatient and inpatient. The high accessibility in form of ramps, lifts, and availability of wheelchairs indicate that persons with disabilities can access the reproductive services. However, there is a significant challenge in provision of disability maternity friendly in the health facilities. The facility assessment has covered several other areas, and the ministry is packaging the information and will provide feedback to the counties to strengthen access to services, especially in maternal care, by increasing number of disability-friendly maternity beds. In addition to the above assessment, the ministry undertook a short survey of 97 health facilities in October 2022 and found that in addition to the above 4 parameters of access, individual facilities undertook various initiatives to improve access of health services by persons with disabilities. Following are some of the initiatives that have been undertaken. Services are brought to the disabled client, and that is happening at Baringo County Referral Hospital. Availability of staff trained in sign language, that's what is NEST at Bungoma Hospital, and sign language interpreters in clinics and outpatient department for the deaf at Kapsabet County Referral Hospital and Thika Level 5 Hospital. Stretcher bearers were at Kakamega Level 5 Hospital, and 5% of human resource recruited are people with a disability. We have go-karts to ferry people with disability from the gate. There is a rail in walkways, and specifically would like to single out Kericho County Hospital. And again, people with disabilities are provided with houses. Sign language interpreters, motorists, wheelchairs for staff and other officers, disability committee, and braille. This exists at Moi Teaching and Referral Hospital. Honorable Speaker, honorable members, on the second part of the questions, where we need to provide a list of medical facilities equipped with disability-friendly infrastructure and indicate the training programs developed and resources deployed by the government to medical practitioners to ensure they are adequately prepared to attend to people with disabilities. Honorable Speaker and honorable members, in line with the rehabilitative services and assistive technology strategy of 2022-2026, the ministry aims to scale up services to all levels of care, including community-based rehabilitation in line with the universal health coverage and the spirit of leaving no one behind. The ministry has undertaken training of all county directors of health and the disability assessment teams on disability medical assessment and categorization, and further developed the disability medical assessment and categorization guidelines to make assessment standards across the country. Training of county teams involved in disability assessment is done for those who request the national level, and it's done on a need basis. In a significant step forward, the Ministry, with support from World Health Organization, is in the process of establishing an Assistive Technology Center of Excellence, which will offer training, innovation incubation, research, and development of local assistive products for users. To catalyze the provision of assistive devices, an organization called ATScale Global Partnership, the Global Partnership for Assistive Technology, we are working together to strengthen the pathway towards provision of assistive products to Kenyans who need it. The third part of the question, what is the government doing to also ensure that such services as occupational therapy, speech therapy, and behavioral therapy, which are essential for children with disabilities, are all covered by the National Health Insurance Fund. Honorable Speaker and honorable members, the ministry has prioritized training of unique specialists like occupational therapists, speech therapists, and behavioral therapists, and also provides post-skills training development for officers to equip them with better skills to manage patients with disabilities. As the House may be aware, honorable members, His Excellency the President ascended to the law the 4 bills, including the Social Health Insurance Act 2023. This act will ensure that no one is left behind in terms of access to healthcare services. As the Cabinet Secretary of Health, the act mandates me to develop a health benefits package that will cover all components of care, including rehabilitation services. The Ministry is working on the regulations and at the same time reviewing the health benefit package to ensure it is comprehensive and covers all spectrum of rehabilitation services needs with no exclusion. This will definitely reduce the out-of-pocket expenditure for people with disabilities. Additionally, the Ministry is also advocating for community members and households with children with disabilities to come out and seek health services to enable them achieve full potential and full integration into their communities. Honorable Speaker and honorable members, I hereby submit. Thank you.
Thank you, Honorable CS. Honorable Senator George Mugo. Pursuant to Standing Order 51C7A, you have the right to ask 2 supplementary questions. And supplementary question must arise from the primary question. It must relate to the primary question. So you may elect to ask those 2 supplementary questions now, or you may allow your colleagues to proceed to pose questions, and then you come last. Which option are you taking?
Thank you, Speaker. I wish to allow my colleagues to come in first, then I'll come in later.
Thank you. Senator Wamatiku.
Thank you very much, Mr. Speaker. I would want to start by appreciating what the Kenya Kwanza government is doing in terms of the health, universal health. Thank you, CS, for that elaborate answer to the question. But fully aware that health is a devolved function, I could have loved to hear you talk about capacity building within the county government so that they are able to undertake those functions that are devolved. Further to that, Mr. Speaker, sir, I would want the CS to tell us what the ministry, in terms of policy, is doing to ensure that the increasing number of mental health disorders, especially among the adolescents, and Nyeri being among the leading counties in men's suicidality, it is an issue that we feel must be addressed both at policy and infrastructure development level. Thank you, Mr. Speaker.
Honorable CS.
Thank you, Honorable Speaker. In my submission, I did indicate what we have done with the counties. As a ministry, we have undertaken training of all county directors of health and the disability assessment teams on disability medical assessment and categorization, and further developed the disability medical assessment and categorization guidelines to make assessment standards across the country. Equally, Honorable Speaker, in the last 2 months, as a ministry, we have undertaken an assessment of all health facilities within the country. We have a preliminary report, and it is based on that report that the ministry is going to put together a strategy on how we work on the gaps that have been identified. Honorable Speaker and honorable members, from my report, we see that we have a long way to go in ensuring that we mainstream disability-friendly facilities within our country, and we shall be putting that in our report to work together with the Council of Governors and see how then the counties can be able to adopt that. Honorable Speaker and honorable members, on the issue of mental health, as a ministry, we have already developed a mental health policy, which we launched, and equally last month, we did launch a mental health and wellness policy at workplace. We have put in place guidelines on how mental health should be handled, and we shall be working together with the county governments to ensure that mental health services are accessible to all Kenyans. But at the national level, we have Mathare Mental Referral Hospital, which I have visited personally, and we have put together a plan to see how we equip it to be able to take care of mental health issues, but most important would be how we work with county governments to ensure that mental health services are available at the community level. But equally, Honorable Speaker and honorable members, in the just launched community health, the universal health coverage, we have recruited over 100,000 community health promoters. One community health promoter will deal with 100 households. And one of the issues that they're supposed to be tackling, Honorable Speaker and honorable members, is to give education and health promotion. So it is expected that they will also play a big role when it comes to handling issues of mental health at the household level and at the community level. I submit. Thank you.
Thank you. Thank you, Mr. Speaker. Thank you, Mr. Speaker, for this opportunity. Yes, I would want to thank the CS for her presentation. In as much as I'm not fully satisfied, I had a first encounter on Friday with some of the community health promoters in Ekerenyo Sub-County Hospital, and looking at it on issues to do with mental health, I think I need the Ministry of Health to come out clear on what policy or what interventions you have to do with issues of informed consent, because most of the time we assume that people with mental health issues can't make decisions on their own. And past interventions we've seen have had decisions made on their behalf through their guardians or parents. So I really need the Cabinet Secretary to come out and really highlight on what deliberate interventions you're making. Because individually, I don't think the community health promoters I see would have capacity to deal with the issue of mental health as it is in society right now. Thank you, Mr. Speaker.
Honorable CS.
Thank you, Honorable Speaker and honorable members. I would like to appreciate and acknowledge the Senator that at least there is evidence that the community health promoters are all around the country, and happy that you encountered one at Ekerenyo Sub-County Hospital. Honorable Speaker and honorable members, in terms of consent for mental wellness, it depends on the degree of the mental health at issue. So depending on what degree it is, then a consent is required from a guardian or a parent. But if one is in a position to make a decision, they are allowed to make decisions on their own, especially if they are adults. Honorable Speaker and honorable members, on the issue of community health promoters, I would like to emphasize that their work is not to treat or handle the mental health issues that will be in the society. They are supposed, one, to educate, and number two, to make referrals to health facilities. That is their main objective. That should they encounter a case, then they should be able to make referral of that person to a health facility. I submit. Thank you.
Senator Dulo.
Thank you, Mr. Speaker. I wish to welcome the CS and the team. Mr. Speaker, over the years, immediately devolution take off. I remember in this Senate we discussed about standard within the counties. And unless we keep standards within the counties, the level of service delivery is not going to assist Kenyans. How can the ministry ensure that the standards are kept within those counties to make sure that there is proper service delivery and there is proper access to service by Kenyans in those counties? Finally, Mr. Speaker, on UHC, Mr. Speaker, just one...
Senator Dulo. Pursuant to Standing Order 51C7B, you're entitled to ask only one question. Honorable CS.
Thank you, Honorable Speaker and honorable members. The issue of standards is a critical issue for the Ministry of Health. And in this current government, we actually have a whole state department responsible for public health and professional standards. So at the national level, we have developed standards, and we do continuous capacity building of officers at the county level. We actually have trained inspectors who are supposed to be looking at the quality at the different counties. Equally, we are building capacity of our regulatory authorities to be able to handle the issues of standards at the county levels. But Honorable Speaker and honorable members, I would like to say that this being a shared responsibility, we have to have a certain level of accountability from the county CEOs to ensure that the standards that we put in place are enforced by their officers within the counties. I submit. Thank you.
Senator Veronica.
Thank you, Mr. Speaker. Honorable CS, welcome once again to Senate, and thank you for the responses you have given. The question you have been requested to answer is sensitive because it deals with persons with disabilities. And Honorable Speaker, what is the ministry policy in working together with organizations and initiatives that are non-profit making, which are adding value to the facilities, medical facilities that are being given to persons with disability? And are you aware of Belarisu Medical Center that is doing cleft lip and palate, and which has speech therapy facilities, and which, if you had an MOU with, you would help a lot of children who have gone through operations on cleft lip and palate? And what are you doing to support such institutions so that they do not fail, but they can use their world-class facility to benefit many more children who have gone through trouble with cleft lip and palate deformities?
Honorable CS.
Thank you, Honorable Speaker and honorable members. One of our approaches in delivering universal health coverage is partnerships with donors, with NGOs, and other non-governmental actors, including civil society, in ensuring that we deliver universal health coverage. What we have done at the ministry is that in the past, most donors, partners have been delivering vertical programs. But it is now at the Ministry of Health, we are putting together to ensure that we work together towards achieving the government objective of universal health coverage and leaving no one behind. Let me acknowledge that I have not personally interacted with the Belarisu, and I'm happy, Senator, that they are dealing with cleft lip and palate surgery. We shall, as we retreat back to the ministry, we shall get in touch with them and see how best we can work together to support them in the work they do. But in the interim, we are working together with all partners to ensure that we leave no one behind in our coverage in our universal healthcare coverage. Thank you, Mr. Speaker.
Senator Gathuri.
Thank you, Honorable Speaker. The CS has given us comprehensive data on what is not available in the health facilities across the country. And that health is devolved. At what point do you share that data with the county governors? Or is it the report, is it only for the national government that you have it? Or the data you are sharing with the county governments so that they can be able to equip those facilities? Or maybe are you in any way suggesting that you'll be proposing conditional grants in the next budget so that you can give the county governments to equip the facilities? Thank you.
Honorable CS.
Thank you, Honorable Speaker and Honorable Members. As I said earlier, that delivery of healthcare is a shared service between the national government and the county governments. Honorable Speaker, in the last 2 months where we did the level of service assessment, this exercise was undertaken together with the county governments. And in all the health initiatives that we undertake, we do it jointly with county governments, so that one, data is shared immediately, that they are able to know the results of the assessment that has been done. Honorable Speaker and Honorable Members, as I said earlier, we shall be sharing a final report on the gaps that were identified. I want to believe, Honorable Speaker and Honorable Members, that then gives this House an opportunity in advocating for more resources to county governments to be able to bridge the gaps that we identified during the report. And I want to thank the Honorable Senator for proposing conditional grants to county governments to be able to deal with the gaps that shall have been identified. I submit. Thank you.
Senator Mandago.
Thank you, Honorable Speaker. I want to thank the Cabinet Secretary for appearing and answering these questions, Honorable Speaker. Honorable Speaker, my concern is on the response that the CS has given, particularly in rehabilitative services and assistive technology for persons with disability. Honorable Speaker, my question to the CS and Ministry is, we know before you are able to successfully help these persons living with disability, the first thing that needs to happen is a proper assessment so that the assistive devices that are given are then appropriate. I would like to know the position of the ministry in regards to establishing proper assessment centers in this country, Honorable Speaker. I'm aware the only assessment center that government has is the one available at the Kenya Institute of Special Education. But considering that is used for assessment and training, therefore it limits the availability of that facility for purposes of assessment. What is the ministry doing to ensure we have at least, if not in every county, every region, a proper assessment center so that persons with disability can be able to access it? Honorable Speaker, I'm asking that question because we once in my county did an assessment of children with hearing impairment, and we had a total of 3,000 children who were brought for that assessment. To our other shock, 2,300 of those children could actually hear with just an hearing aid being provided. But these are children who have missed to go to school. These are children for the last 10, 15 years they have not been hearing. They are hearing for the first time when they are over 10 years, and their lives has been made difficult because of failure to have the assessment facility. I would like to know the position of the ministry on that matter.
Honorable CS.
Thank you, Honorable Speaker and Honorable Members. I acknowledge the question. Previously, assessment was only at one level, at the ministry. But right now, the assessment has already been devolved. So each county has a team, multi-stakeholder team, multidisciplinary, that has been trained to do assessment for disability. And I am informed that this has been happening now for the last 2 years. And we continue to build capacity of those multidisciplinary teams at the county levels to be able to do assessment. But equally, we have assessment being carried out at all the level 6 facilities, which are 6 in the country. So on the 47 plus 6, that means that then we have a total of 53 assessment places where assessment of disability can be done. The ministry, however, continues to do appeal cases where an assessment has been done in the county and the person is not satisfied with the results. The Ministry of Health at the national level, we work on the appeal cases. I submit, Speaker.
Senator Methu.
Thank you very much, Honorable Speaker. And I thank the CS for a very elaborate answer to the question. And I actually went to consult Senator Mbugua because he's the man that saw the question, so that I am able to ask a question that is relevant. And my question to the Honorable Cabinet Secretary. Last week, Honorable Speaker, and allow me from the onset to thank you that you allowed us to do the red ribbons in celebration of the Dyslexia Week last week, Honorable Speaker. And I'm very saddened, Honorable Speaker, because in my opinion, I did not see anything. Or anyway, let me ask it as a question. What did the Ministry of Health do for creating awareness on dyslexia? Because you know, Honorable Speaker, dyslexia is a condition that has many times been misdiagnosed. Senator Bugu and I attended that particular celebration at the Kenya Institute of Special Education, which again, Honorable CS, is important to note that you and your ministry was not represented. At least Parliament was represented because KEDIPA was there, but the ministry was not represented. I did not see them doing anything in terms of awareness. And also finally, I would want to know whether the Cabinet Secretary is aware that 100 kids that have this condition of dyslexia do not have a school to attend in January because the Kenya Community Center for Learning that has been taking care of them has been, Senator Bugu is well aware of this particular challenge. They have been driven out of the place that they have been using as a school for the last about 5 years. At least the other time they were helped by KEDIPA, but we have not seen the ministry do anything in terms of supporting children living with dyslexia. Honorable Speaker, one of the very talented kids that was presenting in that dinner that the ministry was not represented was actually is the best swimmer in Kenya. He got an award of being the best swimmer in Kenya. She's from Nyeri. And when she first went with her mother to hospital, she was misdiagnosed to be a person that has a mental challenge. So tell me, Honorable Speaker, a person with a mental challenge is the best swimmer in the Republic. So the misdiagnosis of dyslexia is a big problem, and I would have expected the ministry to join the whole world last week in creating awareness.
Honorable CS.
Thank you, Honorable Speaker and Honorable Members. I appreciate Senator Methu for bringing out the issue on dyslexia as one of the disabilities that do exist. Honorable Speaker and Honorable Members, as a ministry, we follow the World Health Organization calendar of celebrations of specific days within the health sector. And dyslexia is yet to be put in the World Health Organization calendar of days to be celebrated. However, we continue to provide and create awareness in the day-to-day activities. But I would also like to say that as a ministry, we would like to take a whole of health approach that we are not highlighting just one of the disabilities and celebrating or creating awareness around it, but rather looking at the whole area of how do we mainstream disability into the health sector and health services. Having said that, Honorable Speaker and Honorable Members, it has been acknowledged that children with the dyslexia, if not identified early, then they may not reach their full potential. And I want to acknowledge the one that has been highlighted by the Senator as being the best swimmer. So we want to acknowledge and say that as a ministry, we are really going to work with the 100,000 community health promoters that we have trained, that they should be able to identify these cases early so that they are brought out, so that then alternative ways can be devised on which the children can be assisted to reach their full potential. I submit.
Senator Boni.
Thank you, Mr. Speaker. Mr. Speaker, allow me to congratulate the Minister for successfully midwifing the launch of the universal health care. Mr. Speaker, it looks like it was always going to be a woman minister who would preside over this process, because I recall you and I, in the good old days, it is when Charity Ngilu was minister that she came up with this attempt to have universal health care. So I congratulate her. Having said that, Mr. Speaker, the minister is aware that one of the need that is required by people living with disability in as far as access to reproductive health care is concerned is that a large percentage of them require assisted delivery, the mothers. They require surgery. And the biggest impediment, Minister, is the cost of access to that surgery. Do you have a policy in the same manner that you have for children under 5, so that when these women living with disability, when they go to the healthcare place, they are not denied charges because they cannot afford? Thank you.
Honorable CS.
Thank you, Honorable Speaker and Honorable Members. Indeed, I do acknowledge that women with disability require assisted delivery. As the government, we have 2 programs. One is Linda Mama, which takes care of all women in terms of delivery. And actually, it begins from them being able to attend clinics, delivery, and even after delivery, they are able to attend clinics. This financial year, Honorable Speaker and Honorable Members, the government put 4.98 billion for support of Linda Mama. Secondly, we have government subsidy, health insurance for people living with severe and disability, that they are able to access health services. But having said that, Honorable Speaker and Honorable Members, one of the acts that was enacted is the Social Health Insurance Act. And in that act, we have developed benefit package to ensure that every person is taken care of. Those who are unable to pay, the government is going to work on a program to ensure that they are able to pay for them to be able to access services. Equally, in that Social Health Insurance Act, we have the Primary Healthcare Fund that ensures that all primary healthcare, level 1 to level 3, is publicly financed, to mean that people will not have to pay any out of pocket to access services. I submit, Honorable Speaker.
Honorable Boy.
Asante sana Mheshimiwa Spika kunipa fursa hii. Kwanza Mheshimiwa Spika, nataka toa shukrani zangu za dhati kwa Waziri wa Afya kutupatia fursa sisi watu wa Kwale. Kama seneta wa Kwale pia natoa shukrani kwa niaba ya watu wa Kwale. Siku ya Cancer Awareness Day ilisherekewa katika kaunti ya Kwale nchi nzima, yani jumla katika hiyo siku ya Kwale, yani Cancer Awareness Day ili katika Kenya ilisherekewa katika kaunti ya Kwale, Msambweni Referral Hospital. Yangu kwa niaba ya watu wa Kwale natoa shukrani yangu kama senator wa Kwale na gavana wangu kwa waziri kwa kutupatia fursa sisi watu wa Kwale kwa siku hiyo kusherekea na sisi pamoja. Asante sana waziri, asante sana.
Honorable Senator, you are supposed to ask a question, not to render your appreciation. Senator Tabitha.
Thank you, Mr. Speaker. And let me start by really congratulating the CS for the great job that he's doing. And as a female leader, we are very proud for our female leaders in the Kenya Kwanza government, especially on the bill that was passed recently. Thumbs up, and that's very great. My concern, my question, Madam CS, would be still on the CHVs in terms of their duration of contract and also in regards to the kits that they are supposed to have, because we've noted that some of them do not have, they are not fully equipped, and also in the very remote areas, some also do not have the same kits. And I know the county that I represent, that is Nairobi, we still have some shortages. So I would want to know what framework, what mechanisms have you put in place so as to ensure that there is total facilitation and equipment of the same personnel so that they are able to deliver their services. And just quickly on autism, which is a disability, what is your take on the cost of the medicine that is normally undertaken by these patients, because the cost of medicine is very high? Thank you, Mr. Speaker.
Honorable CS.
Thank you, Honorable Speaker and honorable members. I want to appreciate the accolades from the Senator of Kwale. It was a very nice experience to be in Msambweni to launch the Cancer Awareness Day. Honorable Speaker and honorable members, I would like to highlight that the community health promoters, Senator, we now call them promoters, not volunteers, do not have a contract. One is that these community health promoters are identified by their communities. After being identified by their communities, they are taken through training, both by the county and at the national level. And we have an agreement with the county governments that we are going to give them a stipend. We are going to co-match that we give 50% while the county governments give 50% of a stipend. And that is more of an appreciation, so we do not have written contracts with them. But we have community health assistants that then supervise them to ensure that they are carrying out their duty, and those community health assistants have contracts with the county governments. Honorable Speaker and honorable members, we did launch a total of 100,000 community health promoters. And before we did launch on the 20th, 3 weeks before that, His Excellency the President had flagged off equally 100,000 kits, to mean that each of the community health promoter has a kit that is fully equipped with the items that we have put in there to be able to address the issues within the community. But after the launch, Honorable Speaker and honorable members, we have received feedback from the counties that not all community health promoters were covered within the 100,000. We have received a total, we have put together a total of 20,000 across the county of community health promoters. We are going to put them through training, and after the training, then they shall be given the kits so that they are able then to carry out the work that we have asked them to do. On autism, Honorable Speaker and honorable members, autism is a developmental disorder affecting children, and management involves many interventions, especially medications and behavioral therapy that is being worked on. However, I would like to say that in the new acts that we have now, under the Social Health Insurance Act, we are developing a benefits package. This benefits package, our plan is that it should include everyone, all services that are required. There are no exclusions, there are no limits within that. So it is our hope that as we finalize with the regulations and we go into implementation, no one is going to be left behind, whether with autism, whether in any other form of disability, we should be able to take care of all of them under the essential benefits package that we have developed. I submit.
Senator Kenyo.
Thank you, Mr. Speaker. From onset, I want to thank the Minister. But, Mr. Speaker, having said that, I am aware that we have many community health workers in this country. And I want to say that's a good thing. Comparing it to Cuba, you can only say that in many places in Cuba, we have what we call polyclinics, Mr. Speaker. And these community health workers do a good job. But, Mr. Speaker, if you look at our republic, we say that resource must follow functions. Much of the resource is left at the national level, Mr. Speaker. And when we have these community health promoters, if they diagnose or they have issues with the people they are seeing, they refer them to the health centers, Mr. Speaker, as well as the dispensary. What really frustrates is that when you go to our health centers, Mr. Speaker, and our dispensary, there's no medicine, Mr. Speaker. So the purpose is defeated. Unlike in Cuba, where they say that they are health workers. In fact, they call them the army in white coats. Mr. Speaker, what I wanted to hear from the minister is that what is their program? Like, Mr. Speaker, because many of our counties that we have, they don't have resources. As far as they have been given so many of functions, but the resources are left in the national government, Mr. Speaker. I don't know what the minister would be doing. Like, for example, we have these community health volunteers.
What is your question,
Mr. Speaker? My question is, Mr. Speaker, how are they assisting the counties, Mr. Speaker? Because they have limited resource, because much of the resources, Mr. Speaker, are left at the national level. We don't have equipments in the county government, Mr. Speaker, like, for example, in health centers, where the community health workers are responsible, Mr. Speaker.
Honorable CS.
Thank you, Honorable Speaker and honorable members. Specifically for the community health promoters, we required standardization and consistency. So at the national level, we are the ones who have undertaken training for the community health promoters. Equally, the kit was funded by the national government. We are also giving them gadgets, smartphones, so that they are able to collect data real-time, data that will be used for decision-making in the health sector. That is an investment by the national government. The stipend, 50%, is an investment by the national government. But having said that, Honorable Speaker and honorable members, I did say that 2 months ago, we did a level of service assessment. From the level of service assessment, we have a report that indicates what are the gaps within the facilities in the counties. Notably, we have big human resource for health gaps. We have big gaps on health products and technologies. So we are working together with the county governments to derive a mechanism on which we are able to fill these gaps. But, Honorable Speaker and honorable members, in the enacted laws, the Social Health Insurance Act has a primary healthcare fund. And this primary healthcare fund is supposed to ensure that all facilities at the primary level, that is level 2, level 3, are funded to ensure that they have human resource and they have health products and technologies. You will recall again, Mr. Speaker and honorable members, that one of the laws that was enacted is the Facility Improvement Fund. The Facility Improvement Fund is supposed to ensure that funds for the county, for the health facilities, are ring-fenced and replowed back into health facilities so that then they are used to ensure that there are no gaps in service delivery. So as currently we are working on the regulations, and we should be able and ready to go by in the next maybe a month or 2 months, and then we shall be advising Kenyans on what we are going to do in terms of meeting the gaps that do exist. I submit, Honorable Speaker.
Senator Mario.
Thank you, Mr. Speaker. My question to the CS, to what extent and how are PWDs and their representative organization involved in designing, planning, implementation, and evaluation of health policy and programs?
Honorable CS.
Thank you, Honorable Speaker and Honorable Members. Honorable Speaker and Honorable Members, as we are aware, stakeholder participation is enshrined in the law, and therefore we do involve people with disabilities when we are developing policies at different levels during public participation. Having said that, Honorable Speaker and Honorable Members, at the Ministry of Health, we have officers who are living with different disabilities, and they are involved in drafting and in working on the policies that we do make. I submit, Speaker.
Honorable Senator Ogwa, you may now ask your supplementary question.
Thank you, Mr. Speaker, and thank you, CS, for those elaborate answers. I have two clarifications I would want you to make. One, on the disability-friendly infrastructure, you indicated that the maternity is the least equipped at the level of 7%. I would want you to speak more on this because we've had so many cases of women with disabilities losing their lives at the time of delivery. And two, among the interventions you indicated that have been made at these facilities is the employment of at least 5% of persons with disability. I would want you to speak more on the success of this at the facilities and also at your ministry as a whole in this requirement of employing 5%. Thank you.
Honorable CS.
Thank you, Honorable Speaker and Honorable Members. In terms of the infrastructure, it is indeed true that it's quite low for maternity services, and therefore it's one of the things that we shall be working together with the county governments in filling the gaps that do exist. But Honorable Speaker and Honorable Members, we must acknowledge that infrastructure development is capital intensive. So it is not going to be a day, a month. It is going to be over a long period of time because there has to be serious budgetary allocations for us to be able to fill the gap on infrastructure. On employment, the 5%, as a ministry, we are continuing to ensure that more people are trained to be able to carry out these services. And as and when they graduate from the trainings, then they should be deployed adequately. But as it stands now, the 5% is low, but the only way is to ensure that we have more people trained to be able to handle the different forms of disability that do exist. I submit, Speaker.
Thank you. We will now move to question number 063. This is a question by the Senator for Kakamega, the Honorable Boni. Kindly proceed to ask your question.
Once again, thank you, Mr. Speaker. Mr. Speaker, could the Cabinet Secretary disclose the initial cost of the project for the construction of the Kakamega Teaching and Referral Hospital as was awarded by the county government of Kakamega? State how much of that amount has been paid to the contractor so far and indicate the percentage of construction works undertaken so far. B, what are the reasons behind the stalling of this project? C, what measures will the government take to secure the construction site and put an end to the ongoing vandalism and theft of construction materials, including equipment? Finally, Mr. Speaker, what is the government doing to execute the presidential directive that the national government takes over the stalled project? I thank you.
Honorable CS.
Thank you, Honorable Speaker and Honorable members. Thank you, Senator Boni, for that question. Honorable Speaker and Honorable members, thank you, Speaker and honorable members. Schedule 4 of the Constitution of Kenya distributes functions between the national and the county governments. Under the national government, we have the referral health facilities, which are 6 that are fully, that the national government is fully responsible for. Kakamega County Referral Hospital, from our records, is categorized as a level 5 hospital under the county government of Kakamega. The stall project for the construction of the Kakamega Teaching and Referral Hospital was designed and constructed by the county government of Kakamega, which we had hoped that they will be given, they will have sent in their response so that I'm able to respond conclusively to question 63A to C. So as it is, Honorable Speaker and Honorable members, I'm not in a position to respond comprehensively to Part A, B, and C. Having recognized that, I wrote to the governor of Kakamega County on the 25th of October, and in my submissions, I have attached the letter that I wrote to the governor, asking him to provide responses to Part A, B, and C of the question, so that then I can come with them to this House. And I indeed copied the clerk of the Senate my letter requesting for response. But as to my coming here this morning, we have not received any response from Kakamega County, despite several follow-ups. So, Honorable Speaker and Honorable members, I would like to request that the Kakamega governor is asked to come and respond to the questions or send the responses to my ministry so that I'm able to respond to it. Having said that, Honorable Speaker and Honorable members, on the last bit of the question, the reference is made to the presidential pronouncement regarding the support towards the completion of Kakamega Teaching and Referral Hospital. The pronouncement indicated that resources be allocated to cater for purchase of medical equipment for 100 million Kenya shillings in the supplementary budget of October, and 200 million to be allocated for civil works for completion. Honorable Speaker and honorable members, the 200 million allocation was based on availability of funds to be given to Kakamega County. So far, these funds have not been availed by the National Treasury, and we await for them to avail the funds, then they can be dispersed to Kakamega County. Having said that, Honorable Speaker and honorable members, we are working on a program to equip the Kakamega County Referral Hospital and other hospitals that have major equipment gaps. And the promise or the pronouncement by the President of 100 million shall be then be fulfilled once we are equipping other hospitals. But it's important to note, Honorable Speaker and honorable members, that we can only equip a hospital that has been finalized, that construction must be complete for us to be able to equip the hospital. So we shall be waiting at that point. When that is done, then we shall be putting in the national support of 100 million shillings towards the equipment. I submit.
Senator Boni, do you have any supplementary question?
Mr. Speaker, I hear the minister, but maybe this is testament to why calling ministers to Parliament was an act whose time had come. Following the pronouncements by the President, President Uhuru, former President, to that effect, and subsequently President William Ruto to the same effect, Minister, what has happened in Kakamega is that the county government has pulled out of that hospital. The construction has stopped. security for the project has been removed. And now what is happening, Minister, is that there is vandalism both from employees of the county government and members of the public at a great cost to the public. Could you undertake in this parliament that you will not shift the responsibility to us, but that you will go to the ground and see for yourself, so that you agree in the spirit of interdependence and interrelation with the county government on how to secure the project, protect the equipment that had been brought there by the suppliers, and actualize the pronouncement by the president to the public that the institution is being elevated to level 6 and the national government will take responsibility thereafter. I request that you consider what I'm saying seriously, because if you don't, 6 months from now or less, there will be no hospital. And the investment runs in billions of shillings. Mr. Speaker, I prefer not to ask a question, but just request her to do slightly more. And I'm willing to cooperate with you. We go together so that we can rest this problem.
Thank you, Senator Boni. If I got the CS correctly, what the national government did was give a very precise assistance in form of 200 million. The national government never indicated that they're going to take over this facility. So matters of securing the facility cannot be put on the shoulders of the CS. Matters of the construction having stalled cannot be put on the shoulders of the national government. The national government promised to assist the Kakamega County government with 200 million, which 200 million is yet to be availed. So as the county is waiting for this money, it is upon and it's a responsibility of the county to make sure that this property is fully secured. However, Honorable Sears, being the policy holder in matters health, what do you say about the request by the Honorable Senator for Kakamega?
Honorable Speaker and honorable members, let me first clarify that in the previous government, the governor of Kakamega, Governor Oparanya, had written to the ministry and requested the national government to take over the facility. And therefore, at that point, then the national government would have been at 100% responsible for completion and ensuring that the facility then operates as a level 6. However, Honorable Speaker and honorable members, when we came into the office, I followed up that letter with the Kakamega current governor, Governor Barasa. And he did indicate to me, I have been to Kakamega on 2 occasions, and he did indicate to me that they were not going now to hand over the facility to the national government for it to be a level 6 facility. However, they were going to operate it as a level 5 facility. Honorable Speaker and honorable members, based on that, then the role of the national government is to assist the county government to ensure that they complete the facility and run it as a level 5. But having listened to the honorable senator, having visited the project myself on 2 occasions, that project is huge. And I will put together a team, a multidisciplinary team from the ministry. We'll seek the senator's support that we go and highlight the issues to the honorable governor, paint the bigger picture of not just completion, but equally of running the facility. And hopefully then that we can get to an amicable solution on how we assist the counties. But as it is, its responsibility lies squarely with the county government of Kakamega. I submit.
Senator Mandago.
Thank you very much, Honorable Speaker. My question to the CS. I've had a response on the issue of Kakamega Hospital on delineation of function. My question to the Cabinet Secretary would then be, why is the ministry then building a maternity facility in a Kerenyo sub-county, which is also a devolved function? So I think we would then want to know if there is really that clear delineation of functions, then why is the ministry going to perform functions that are supposed to be performed by the county government of Nyamira?
Honorable CS.
Thank you, Honorable Speaker and honorable members. Thank you, Senator Mandago, for that question. The responsibility of health is shared between the national government and the county governments. Honorable Speaker and honorable members, as we sit today, I have requests from 42 of the 47 counties for support of facilities at different levels. So, based on availability of resources, some from partners, some from donors, some from the national government, then we allocate resources based on the requests that we have received. So Ekerenyo did submit a request, and they are receiving that support. We are evaluating the other requests that we have received, and based on availability of resources, we are always willing to support the county governments to ensure that all Kenyans have access to health services. I submit.
Senator Gloria.
Thank you, Mr. Speaker. Perhaps a follow-up question is there a methodology of prioritizing the requests? Because from what I hear from Senator Halwale, there is a dire situation in Kakamega of a pending project, and that seems to me as a request as well. So maybe if we can be given a methodology of how the requests are prioritized, so that people might not think that there's an inclination of just political goodwill on one side and not the other side.
Honorable CS.
Thank you, Honorable Speaker and honorable members. Yes, there is a prioritization criteria. Mostly is based on the need of the populations, and two, the level of investment that is required. So where there's a need, there's a huge population that needs a health facility, and the level of investment is not that high, and the resources are available, then that project is prioritized. The case of Kakamega, you will agree with me, Senator, it is a huge project that requires billions to finalization. And it is not just Kakamega. Even my own county, Trans Nzoia, needs resources to finalize their referral hospital. So based on availability and equally the cooperation of the respective governors to be able to work together with the national government on completion of their projects, I submit.
Senator Kenyo.
Mr. Speaker, mine is not a question, but just an observation, Mr. Speaker. When she did say that she's
Senator
going to, she's just...
Kenyo. Senator Kenyo.
Mr. Speaker,
please ask a supplementary question. If you have none, just
okay, Mr. Speaker, the good Cabinet Secretary mentioned that she's going to set a multidisciplinary committee that will look at the issue of Kakamega Hospital. Mr. Speaker, my request is that we would request if she can include our good chairman of the Committee of Health, Mr. Speaker, so that he can assist our good senator of Kakamega. Thank you, Mr. Speaker.
thank you. You need not respond to that. It's not a question, as the senator said. We need to conclude this, Senator Boni. What say you?
Mr. Speaker, thank you for your indulgence. This is not for the minister, it's for you. Given the opportunity I had, understanding Order 53.1, which I lost because I preferred to go the question way. And it is quite clear that the minister feels the governor, not feels, the governor has appealed to the national government that he doesn't want to release the project contrary to what his predecessor had done, contrary to what we had made the president to pronounce himself to when he visited the county. Could you allow me, Mr. Speaker, with your indulgence, that you direct the Committee of Finance. The Committee of Finance is in Kakamega next week to look at the state of the roads project. If you could pronounce that they carry this matter, and if possible, you direct the Committee of Health to also join us, because the project we are talking about is over 5 billion shillings, and 5 billion is going down the drain. It cannot be right just because of, could it be with the national government or the county government? Let's get the project going, whether it is superintended by the national or the county government. I request that you consider that, even if necessarily now, but you can make the pronouncement later, before next week. We are supposed to go there on 9th for the roads.
Senator Boni, this is a house of rules and procedure. You have not lost your right under Standing Order 53. Indeed, you can request for a statement, which then can be committed to both standing committees. That is the Committee on Health and the Committee of Finance and Budget. The CS has not substantively dealt with 2/3 of your questions because they fall squarely within the ambit of the devolved unit, that is Kakamega County. And therefore, we cannot say, because the matter has been asked to the Cabinet Secretary, it cannot be asked to the Health Committee. And therefore, if you still feel inclined to pursue this matter through the committees, all you need to do this afternoon is to lodge in your request for statement. It will be processed, and it will be committed to the two committees, and by next week, you'll have the committees in Kakamega with full mandate, because they will have been committed to their hands.
Thank you, Mr. Speaker. I'm so grateful. But let Hansard reflect that the potential loss of these billions of shillings and loss of project and the consequences to the people of the region is because of trade unionism in the Council of Governors, Mr. Speaker, because they feel that the national government wants to take away duties that they would like to discharge.
Senator
the
Boni.
county of government of Kakamega is not able to discharge, Mr. Speaker.
Senator Boni, you'll make that statement when you get to Kakamega. That's a better forum, not the plenary. Honorable CS, let me take this opportunity to thank you for availing yourself for purpose of responding to these questions. You are now free to leave to do what you're supposed to do. And thank you for the good work that you're doing. You may leave. Now, the next question is the question by